Thank you very much for sharing your knowledge with us. It is actually very, very interesting. And the patients, what they mostly ask, so they already know that urticaria may be related or maybe not related with additional diseases. So the most common question is, so if I treat, for example, my thyroid dysfunction, will I get finally rid of my urticaria? So how is it?
So yeah, yes or no. We always recommend to get your disease in order, because in most of the times, about 50% of 60% of the time, if you control your baseline disease, you get also a control of your urticaria. But sometimes it doesn't happen, and we have to continue treating and find other ways to treat the urticaria.
So if the patient is interested to actually get a general checkup and is looking to investigate other health conditions, what specialist should the patient be referred to? What specialist to visit? What most important blood work to run?
So thank you for your question. Really interesting. Yeah, so for first, it will be the main physician will be the Hausarzt.
General practitioner.
General practitioner. To do a basic workup. No, we also do tests for liver, for the Niere. I am
Kidney
just
function.
changing to German. Yes. Sorry.
We'll get it through. We'll just find a common language here.
Yeah.
No worries.
And just to do a workup and see if they find anything. If you have a cardiovascular disease, you should go to the cardiologist. But if not, just go to your dermatologist or allergologist to get your urticaria and tell you which test should be done.
And there is also a very important question that I also see here regarding the Helicobacter, the gastrointestinal tract infections. Is it worth investigating that? And any chronic infections, should we do the investigation on it? Dental history, gastrointestinal history, does that make sense to take a deeper look at?
Yes, it does make sense. If you have trouble with your stomach, you have a little bit of burning sensation or reflux, you should get that checked, because if you have a Helicobacter pylori, in most of the cases could be eradicated. So you get therapy, and then it could be that your urticaria gets better.
And there's one more question from the audience. So maybe Özge can also get involved a little bit if you have something to share on this topic. So regarding the hepatitis and Helicobacter pylori, what pylori, I think should be the right pronunciation. I'm sorry for that. What should be the clues for the physicians to investigate the patients deeper into hepatitis, possible history, or Helicobacter? What would be the signs for the patient to get themselves checked, or for the physician to actually take a deeper look into the hepatitis history?
Should I start?
Yeah, you can start.
In the recent guideline, it's not recommended screening for hepatitis, so I don't usually screen for hepatitis or Helicobacter pylori. But in some patients, maybe who not respond all the therapies, medications, we can, if we need further evaluation, maybe then. But in routine examination, I don't do, because, as I said, the recent guideline doesn't recommend it.
Thank you very much. And regarding the comorbidities, so metabolic syndrome might have some connection with urticaria. And there is another concern that the patients have is the weight gain of the usage of antihistamines. And we have the question, is the weight gain some possible side effect and can be related with metabolic syndrome in any way regards to urticaria? Maybe Carolina and Özge, you can a little bit contribute on that.
So metabolic diseases or syndromes are also, so what we see here are these are patients that tend to be a little bit older, which is also the normal population for this type of disease to develop without anything to do with the urticaria, no? Without it doesn't have to be related to the intake from antihistamines.
Okay, good. Özge, do you have something to contribute to that?
Yes, little bit maybe. Patients usually complain about weight gain after antihistamines, but there is no mechanism for that scientifically. So they have to use it and keep to use it without afraid of gaining weight.
Yeah.
Okay, good. That's a very good thing. And especially we have a question regarding levocetirizine and cetirizine. Is that to be known somehow to be related with weight gain? Does it say in side effect that it might be related with that or development of the metabolic syndrome? And is there any recommendation what specific antihistamine should be used for the patients that tend to have metabolic syndrome? Is there any specific antihistamine, or it doesn't matter, and none of the histamines are known to be causing this?
So, you wanna answer us? If you want, if not, I. So for
I just wanted to maybe split the question because it might be complex a little bit. So first of all, is levocetirizine or cetirizine are known to cause weight gain or contribute to metabolic syndrome? This is the first question.
It's not known, and like I said, it tends to go to patients that are older, and it comes normally for this age.
Okay, good. And are there any specific antihistamine that we should choose always for the patient that has metabolic syndrome, or we can choose any antihistamine and they're equally good?
So they are all equally good. We have to try to find which one works better for the patients, that gives less maybe tiredness, that doesn't produce so much tired, or that they can concentrate well and they'll have other effects. And for that, maybe we have to try a few before we say this one is the right one for you.
Okay,
yeah,
good.
They're all good.
Perfect. Then thank you very much. And now I would like to interrupt our question session just very briefly and give the stage to Kristen just to share the patient journey with us a little bit more and share a little bit more insight from the other side, from the patient side, the most important one. So